Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Drug overdose deaths are a significant public health concern globally, with devastating consequences for individuals, families, and communities. In this episode, we delve into the profound impact of the opioid epidemic by examining research that sheds light on how many people have been affected over the years, as well as the demographic disparities and vulnerable populations included. Drug overdoses are known to be one of the leading cause of injury death in adults, according to a study done by Spencer and colleagues 2022. This study discussed the rising number of drug overdoses in recent years. Although drug overdose deaths have been rising over the past 2 decades in the United States, in 2021, there were over 100,000 reported drug overdose deaths, showing a 14% increase from overdose deaths in 2020. In a more recent study done by the same researchers, Spencer and colleagues 2024, the rates of drug overdose deaths were stable. Within the year, there were also over 100,000 reported drug overdose deaths. That's 2022. In 2017, just a few years earlier, Dr. Dowell and colleagues discussed the underlying factors of drug overdose deaths. Since 2010, there has been a 200% increase in overdose deaths involving illicit opioids. This includes heroin as well as synthetic opioids, which we've touched on in previous seasons and episodes. The rise and the risk of the use of synthetic opioids. However, in the previous episode, we discussed how the opioid epidemic in the United States was largely driven by prescription opioids, particularly drugs like oxycodone and hydrocodone. Originally intended for pain management, these drugs became widely prescribed in the 1990s and 2000s. They contributed significantly to the pandemic. At one point, we knew that more than 4% of the adult population were misusing prescription opioids, and in 2015, more than 33,000 deaths were attributed to overdose by illicit and licit opioids, according to a review done by Skolnick. Unfortunately, stigma and stereotypes surrounding overdose and opioid use has heightened fear and shame, but the reality is that it can happen to anyone. However, disparities in the United States have resulted in some populations experiencing more overdose than others. In a study by Singh and colleagues, 2019, they examined the observable trends of overdoses in the United States by social determinants like race and ethnicity, socioeconomic status, and geographic area. Using the National Mortality Database from the United States National Vital System from 1999 to 2017, numerous trends were evident. In drug overdose mortality rates by race and ethnicity, they found the highest to be among non-Hispanic whites, with an average rate increase of 7.6% per year. Additionally, drug overdose mortality in women progressed significantly faster than those in men, having a 6.7% annual increase. Race and gender were not the only things that they examined. Age also showed significance. Those between 55 and 64 years old experienced the highest overdose mortality. However, it did not just affect those who were older. Between 1999 and 2017, there was a 4-fold increase in drug overdose mortality among young adults, ages 20 to 24. Likewise, rates of suicide by drug overdoses among teens 12 to 19 increased between 2009 and 2017. Not limited to just age, gender, and race, overdoses disproportionately affect vulnerable populations, where access to healthcare and treatment is often limited. One of the populations is among those who are incarcerated or who were previously incarcerated, which we will discuss in more detail in a later episode. Additionally, overdoses may affect those who are experiencing homelessness. In an article by Fine and colleagues 2022, the authors focus specifically on overdose mortality amongst the unhoused population in Boston from 2003 to 2018. Individuals facing homelessness may turn to opioids or illicit drugs to help cope, engaging in risky sharing practices or using drugs that can be intentionally contaminated with other substances. In this study, they included 60,092 adults who were experiencing homelessness and received care at Boston Clinic for the Homeless. By the end of the study period, there were more than 20% of those who had died from a drug overdose. They found that drug overdose accounted for 1 in 4 deaths among this population, as well as opioids being found responsible for the majority, 91% of the drug overdose fatalities, particularly the use of synthetic opioids and combined substances, which have been becoming predominant in recent years. It is apparent that drug overdose deaths continue to pose a significant public health challenge globally, with profound impacts on various types of individuals. The opioid epidemic, driven initially by prescription opioids and later compounded by illicit substances like heroin and synthetic opioids, has claimed tens of thousands of lives annually in the United States alone. Despite efforts to address this crisis through research and policy intervention, disparities persist, with certain demographics and vulnerable populations disproportionately affected. Factors such as stigma, limited access to healthcare and treatment, and socioeconomic inequalities contribute to these disparities. By examining the nuanced dynamics of overdose deaths among diverse populations, we gain valuable insights into how effectively we can address this multifaceted crisis and prevent the loss of life within our communities. Strategies that prioritize prevention, harm reduction, and equitable access to effective treatments will be crucial in combating this epidemic, hopefully reducing the devastating toll of drug overdoses on society. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of Aced It.